Good afternoon, everybody. My name is Denise Balch, and I'd like to welcome you here to the second in our prior authorization framework and accreditation program series of webinars. I am, as you may already know, if you joined us for the first webinar, the Executive Director of the Prior Authorization Framework and Accreditation Program. We'll just call it PAFA or PAFA from now on because it takes too much to say. Today, I'll be joined by panelists John Anacleto, who's a healthcare consultant with Anacleto Consulting, and Andrew Wynn, who's a principal with Rinrock Consulting. So for the next, I guess, almost an hour, I'm going to be sharing some insights into the PAFA program. In the first webinar, the first session, for those of you that maybe weren't there or just as a refresher, we looked at what PAFA actually is, what the goals of PAFA are. We took a really quick look and just a very high-level view of management and oversight, how the guide was developed. We gave you an outline of the program guide so you knew what sections were in it. We very briefly looked at membership and how to become accredited and what the benefits are of getting involved. So we are going to do just a very quick review of that. I'll just hit a couple of highlights from that before we get into the meat of what we're going to talk about today. But first, just to give you an overview of what I'll be covering, I'll be talking about the guiding principles that led to the development of the framework and kind of what we've been referring back to. We'll talk about governance and how that's coming along and who our advisory board members are and what we're looking for in accreditation panel members. We'll talk more about membership and associate membership, so we'll give you some details and answer any questions you have. And we'll talk about the member accreditation process as well. And then we'll have that panel discussion, and John and Andrew, who are on our framework and accreditation advisory board, will be joining me for that discussion. And then on February 27th, we'll be digging deep into the framework. So there's lots in the framework. In fact, Andrew, John, and I were talking about this yesterday, and it is very prescriptive. So there's lots of detail in there. So we'll be looking at that, having a discussion with you about it. And then we'll talk a little bit about our plans for reporting and our annual industry survey. So why all the detail? This is one of the questions and things that we were discussing yesterday when I was putting the final details on this presentation. So why are we going into all this detail about management and oversight? Well, it's really about credibility. For people to understand really how significant a PAFA is in the marketplace, and in order to establish and keep our credibility, we need to make sure that industry stakeholders are aware of the nitty-gritty of the governance and the management and the framework for prior authorization for the program. So it sets a high bar for demands on payers for accreditation. And so we need to have that credibility behind us in order for payers to be confident, as well as other stakeholders, that this is really a credible program. We've taken the time to research and meet the needs of the Canadian marketplace. So we're confident that the work that we've done in putting this framework together is what will meet the needs of the Canadian marketplace. We've gathered input from experts in prior authorization and on the PA landscape at a wider level or a higher level. And so we've taken all of those things into consideration. We've also researched practices, legislation, and position statements within and outside Canada. We thought that was really important to understand how prior authorization worked in other countries and what requirements and legislation and position papers were in those environments so that we could learn from that. And we have also created an appropriate corporate, i.e. a nonprofit, and governance structure so that you can be confident that it's not just Denise's show, that this is something that will be around long after I have retired, And it will be something that has the input of multiple people, and so we can remain impartial. And so payers, as well as members and associate members, can be confident that they're in good hands and that the information they provide to us is in good hands. We've also developed the framework and accreditation guide so that it is clear. It is very prescriptive, as I mentioned earlier, and it is very detailed. So it's a lot bigger than we initially set out to put together. But when push came to shove, with all the research that we'd done and the input we received, we knew that we had to get down into the nitty-gritty. So I think this is probably, graphics and tables and charts are always good. Pictures, speak 1,000 words. So what I wanted to do today is just give you a map of what the framework is and that guide is. And today we're just going to be looking at the guiding principles, governance, and membership and accreditation. So that's what we're going to be looking at today. And then, as I mentioned earlier, we'll be getting into the nitty-gritty of the framework and then reporting an industry survey at our final session. But this is something that I think will be useful to you, not just now, but as you move forward, whether you decide to look into membership or associate membership, and for any payers on the line, or who are listening to this from our website after the fact, then you can also get a better idea of what the actual approval process or the accreditation process is as well. So in terms of prior authorization, again, this is just a bit of a refresh from the last session. It was really created and is still used to manage specialty and high volume drugs, including GLP-1s, which has caused a bit of an administrative nightmare, I think, for payers and probably physicians and patients too. In the marketplace right now, not necessarily all of these are covered by private plans, but there are around, give or take, 500 specialty drugs for serious, disabling, or life-threatening conditions. And we've seen this number grow considerably since the first specialty drugs were introduced into the marketplace. In fact, I think the first one, or biologic, was actually insulin, but the first sort of what we would term high-cost specialty drugs were introduced in the marketplace. So this has grown quite a bit. And the prior auth environment is very complex. So we see that center block that requires prior authorization pulls in a number of stakeholders. Not only are there 500 or so drugs in the marketplace, but there is a paper-based prior authorization process, which again causes lots of challenges. We'll talk a little bit more about that later. Physicians and EMRs are involved, electronic medical records, patients and plan members, of course. There's usually a coordination service, either on the private side, patient assistance programs, and on the public side, drug access navigators, originally for oncology, but they're now working in other spaces such as MS. They're on the outside or on the fringe. There are pharma-funded compassionate programs, so that can help a person get started on a drug, or it may provide them with additional dosing if the dosing that they're approved for in their public or private plan is insufficient to maintain control of their condition or manage their condition. And of course, we have public and private payers' unique criteria. So that we know that's non-negotiable, but it definitely puts complexities into the process, because a physician may understand, say, what one insurance carrier's criteria is because of the number of patients that are insured by Sun Life that they manage, but they may not know what another carrier's criteria is. And so these can vary slightly, and that just adds to the complexity. In 2020, we issued the white paper on private payer prior authorization. You can still find that at the Simplified Prior Auth website here. And we did an in-depth research study on prior authorization in the marketplace. And what we have found that still remains true today is that it's, as I said, a very complex marketplace. And so the mandate really of the Simplified Prior Authorization Initiative, which I still manage, was to educate stakeholders about issues, advocate for change, engage stakeholders in the discussion and in the call for change, to help create solutions or to foster the creation of solutions and drive stakeholders to action. So we've done that over the last, say, 4 or 5 years through blogs, podcasts, webinars, articles, and speaking engagements. We also developed a very robust website that has lots of resources, explains what electronic prior authorization is, and talks about the prior authorization process from the perspectives of each stakeholder group. We've engaged in ongoing dialogue with industry stakeholders, and we've examined and sourced electronic prior authorization and solution providers and provided them with input on our perspectives based on our research of what is required in the marketplace. And finally, the last kind of mandate within the recommendations that came out of that Simplified Prior Auth report is the Prior Authorization Framework and Accreditation Program. And that's what we're here to talk more about today. So that's so much for your review. And we're going to get into the meat of what we're all here for today. So, oh gosh, here I'm going to do another review. So whoops, I seem to be going all over the place. So I guess we've got one more slide on this, and it is a Canadian nonprofit that was developed, has developed a credible framework for efficiencies in prior auth and an accreditation process for payers who adopt the efficiencies that are identified in the framework. So what's the goal? The goal is to engage payers to make positive changes in their claims processes and practices. And who benefits? We're going to talk a little bit more about this, but the bottom line is that everybody benefits. Patients and plan members, most definitely, because when a process is improved, then they wait less time for their medication, and it's less of a hassle to actually get the medication in the application process. Patient support programs benefit, whether they're public or private, because those programs, those individuals have a more efficient process to work with, particularly if it's an electronic process. Physicians and a pharmacy also benefit because physicians and pharmacy can spend a lot of time with patients, helping them navigate the system, working with patient support programs, and trying to work out access arrangements for patients and completing lots of paperwork. And of course, members, both public and private, and associate members, so non-payers as well. So let's look at the 4 guiding principles. Before we got started into the details of the framework, one thing we wanted to do was we wanted to have some principles to fall back on, so that when we went back to any of the requirements or either accreditation or membership, that we could always fall back on. There were actually 4 fundamental values and 4 guiding principles. So the 4 fundamental values, which I haven't included in this deck, just to keep things a little bit less complicated, are that PAFA be fair, current, relevant, and achievable. And that's sort of our internal measure. And then our external measure is that the 4 guiding principles are communication, so that we want to be using patient-centric, plain language, transparency and fairness for non-proprietary aspects of PA, that there be consistency, so evidence-based, informed, and consistent guidelines, practices, and decision-making that's equitable, fair, and reliable, and efficiency, so that we look to continuous improvement, including the processes, practices, resources, and technologies. So those 4 fundamental values, which are kind of our internal gauge, as well as those 4 guiding principles, are really the two pillars of the program. So we developed the guiding principles working with PA stakeholders who understand and have experience of prior authorization. We looked to a network of 28 industry stakeholders who participated in the guide. So that was a wider group that was able to review not just the guiding principles, but the actual framework and accreditation program itself. So they had the opportunity to review and then provide input and consultation. And then we also really relied quite heavily on two pieces from the US. One was the US Prior Authorization and Utilization Management Reform Principles, and the other was the Consensus Statement on Improving the Prior Authorization Process. So without going into a lot of detail, these two groups consisted of stakeholders across the prior auth spectrum in the US, including medical groups and associations, healthcare providers, and other relevant stakeholders. So these were very credible sources in terms of developing the guiding principles. So I want to move on now that we've established those fundamental values and those guiding principles to the governance of PAFA. So we have a board of directors and there are 3 board members, and that's a minimum requirement in Ontario for nonprofit approval. We have myself as the chair, and then John Anaclato, who's on the line today and is a member of our Framework and Accreditation Advisory Board. He is part of the board of directors, and then also our corporate lawyer, Narish Mizir of Mizir & Company. Now, the 3 is the minimum. That may be expanded in the future as the program picks up steam and grows, but at the moment, that's sufficient for our purposes. And then, of course, at this point, I'm the executive director. One of these days, I'll hang up my hat and retire, but not before we have a replacement for me, that's for sure. The actual Framework and Accreditation Advisory Board, which I just mentioned, John is a member of, and also Andrew, who are with us today. So what's the purpose of that? Well, the board is really to provide oversight of the PAFA program itself, and that ensures that it remains aligned with those 4 fundamental values I mentioned and those 4 guiding principles. Their responsibilities at a high level, and we do have a terms of reference that we're just finalizing, their responsibilities are to monitor membership and associate membership requirements. So if the market changes and we need to adjust those requirements, then they can do that. Review and update the framework. So we want I can't stress this enough, but we want the PAFA program and that guide to be more like a living document, so that as the market changes, as we see the needs of stakeholders change, that framework and accreditation program will be updated. And so we're going to be making regular reviews, or the advisory board is going to be making regular reviews, and we will make any updates that are necessary. In terms of other responsibilities, we'll get into more about what these are later, but they will be overseeing the annual surveys and reporting that PAFA will be putting out publicly into the marketplace, and they will provide input and oversight on the accreditation panel. And I'm going to talk to you about the accreditation panel too. And they'll also be responsible for providing oversight of communications, including blog podcasts, webinars like this, and any other speaking engagement and communications. So as you can see, we've really thought through that process of governance based on a true corporate model. In terms of the actual advisory board, I'm kind of the one constant in this, so I hope they don't get sick of seeing my face. I'm going to be the executive director, and I will also chair the advisory board. John, as we've already mentioned, Anaclato, Imtiaz Khan, who's a rheumatologist in Mississauga, is also on our advisory board. Hussam Majali, Sam, who's a gynecologist, and he is also on our call today. And the patient group, we actually think we have someone. We just need to get final board sign off from her board. But so I won't tell you her name, but we hope to have that announcement very soon. And then Todd Stephen, who's with Select Path Benefits and Financial, and also who's a member of Benefits Alliance. And he is, I believe, a vice president with Select Path, and he's on the line today as well. And then Andrew Wynn, who's the principal of Winrock Consulting, is also on the line today. You have their bios, both John's and Andrew's, in your agenda, but I'll be telling you a little bit more about John and Andrew later as we start our panel. We also have 2 places for payers. So we really want to make sure that on this advisory board, we have a cross-representation from the industry. And so that is why we've got a couple of doctors who are very familiar with prior authorization, a couple of healthcare consultants, benefit consultants, and we wanted to make sure that there are 2 places for those payers. And so we have had some interest. I'm still in my early days of pounding the pavement to talk to payers and other stakeholders to encourage them to join as a member or associate member. But I'm confident we'll have those spots filled fairly shortly. So where is the advisory board now? What are we working on? Well, I briefly mentioned that we are finalizing our terms of reference. So we had a discussion about that just a couple of days ago. I have some notes to send to the group, and then I think we'll be pretty much done. And we will be finalizing our plan for 2025. Everything is in draft in an Excel sheet right now. And the next time we meet, we will be reviewing the items that are in that Excel sheet to confirm that we're okay with moving forward. We will be conducting a review and updating the guide, making any tweaks since it was just launched in the fall. But if there are any tweaks in that document that need to be made, we'll do that. We're going to review and approve the accreditation forms when I finish them. And then we will be appointing or inviting individuals to sit on the accreditation panel. We will also be, as I mentioned earlier, this group is responsible for kind of overseeing and approving communications that go out. So we'll be sending out a number of blogs, webinars, and attending conferences. And there will be, they're also responsible for member and associate member only webinars or meetings. So we plan to have those as well. So it'll be member or associate member only events. And we will be working on preparing for our first industry survey and prior authorization, kind of like the Benefits Canada survey that you see, the healthcare survey. This will be a prior authorization survey. So we haven't done a large check on prior authorization since that white paper was conducted, that research paper. And so we definitely want to have this process in place as soon as possible so that we can have that initial industry survey done. And then that will be repeated regularly. And then, of course, later in the year, we'll be developing a plan for 2026. So let's talk a little bit about the accreditation panel and what that does. So the job of the accreditation panel, once we have it put together, is to review and approve any accreditation applications that are submitted by payers. Now, payers can be public payers, and they can also be private payers. It's not necessarily, private payers doesn't necessarily include just insurers. We know that Express Scripts, as a pharmacy benefits manager, adjudicates many prior authorization claims for a number of smaller or medium-sized carriers. So that's why we've kind of used the term payers as opposed to insurers. The panel will also ensure that each applicant meets the established framework. So they will be measuring the applicant's information that they provide in the application package against the framework. And their responsibilities will also include reviewing the accreditation applications, that there's consistent decision making, and there is a right to audit to verify payer adherence to the framework. And then also they will be responsible for helping us recognize accredited payers. So at the bottom of most of the slides, you'll see a reference, and most of the references will be to the guide, but there are a couple of references that aren't included in the guide. So what will the makeup of the panel be? There will be 5 members. There'll be the chair, which for right now will be me as the executive director, and there'll be 4 other members from a mix of stakeholders. We will be excluding payers and any other stakeholders with a conflict of interest. Obviously, if a payer makes an application for accreditation, they'll be providing us with many details that they may not want to share with their competition. Therefore, we want to make sure that we don't have a conflict of interest and that payers can be confident that their information is not going to be leaked out, that it's going to stay within that accreditation panel review. So membership and associated, membership and associate membership. So what does that actually mean? Well, bottom line is, very simply, membership and accreditation is only available to payers. And as I mentioned earlier, payers would include insurers, any pharmacy benefit managers that adjudicate prior auth claims, any public payers that adjudicate prior auth claims, and others that make reimbursement decisions on behalf of payers. Associate membership is available to all other stakeholders. And it's important to remember that only payer members can apply for accreditation. Once they do apply for accreditation, they can then use our branding for their membership designation. So a payer can use their payer member branding, and an associate member can use their associate member branding. And so we'll be providing that once membership is approved. Then we'll be providing that branding so that that can be used by the individual members or associate members. So how do you become a member? Well, there is an application process, and the membership applications are actually online applications. We kind of figured that if we were promoting better administration practices and electronic prior authorization, that we should be as electronic as we can and not worry about paper and faxes and all that kind of thing. So the prior authorization application form for payers is on our website. So that application needs to be completed. And then there are a couple of additional requirements. Payers must make a written commitment to internal and external stakeholders to PAFA's guiding principles. So there we go. We have that foundation so that we're all on the same page, and submit copies in their PAFA application. So we do provide samples online on that link of what those written commitments can look like. And there are 2 samples. One is for internal and one external. So the internal would be to those individuals that are involved in the prior authorization process or decision making. And so they should be aware of the guiding principles that their organization has committed to. And we will need a sample of the communication or evidence of the communication that has taken place with their employees. And on an external basis, there are requirements in the application and in the guide that, as you can see on page 30, that external communication has to be made via the applicant's website. So the guiding principles have to be posted on the website in the prior authorization section so that all stakeholders, including PAM members that visit that page, are aware that both the organization is a member and that they are adhering to the guiding principles of PAFA. In terms of associate members, the application process is very similar. Again, it's found on our website. It's a slightly different application form. So that again can be filled in online. And we recommend, but we do not require that the applicant also submit a written commitment to PAFA's guiding principles and submit a copy of that commitment in their application. And again, we've included a sample online that can be downloaded. And really what membership does is it really demonstrates, as the sidebar here says, that they are, it demonstrates that they are supporting prior authorization, the prior authorization framework and accreditation program, its fundamental values and its guiding principles. And both of those things are listed on page 9 of the guide. So why bother? Why become a member? Well, we think there's a number of reasons, and we we're actually talking about this yesterday. Certainly, there's from a purely sort of selfish standpoint, as a member or associate member, there's industry recognition for supporting improvements in prior authorization. So even if a payer is not accredited, even if they're just a member, then they are supporting the work that we're doing, and they are saying to their clients, to their advisors, that we support improvements in prior authorization. And we're doing that by being a payer member of PAFA. We will also be recognizing members and associate members on our prior auth website. And we'll also be making announcements of new members in blogs and articles that will be available to our mailing list. I should say that the question may be, well, how is that going? Well, actually, it's going quite well. We've, as I said, really, it's just been since the holiday season that I've been gradually making inroads into my list of people to connect with regarding membership and associate membership. And we should have certainly, I would say, a handful of members and associate members to announce probably within the next month. So we have some commitment already, but we will gather those together and then we'll make a formal announcement. They will, as I said, be recognized on our website, but we'll send an announcement as well. They will also be able to use those logos. So I mentioned this earlier, that on their communications, in their client presentations, they can also say that they're supporting improvements in prior authorization and supporting the guiding principles of PAFA. And as a result, they can use our branding. They are also eligible as members or associate members to apply for one of 9 seats on the Framework and Accreditation Advisory Board. We will be, our advisory board members do have a limited term. And so while we haven't enforced that requirement initially, just to get us started, that will be a requirement moving forward once we're full to our 9 seats. And they do have, associate members do have the ability to apply for one of 5 seats on the accreditation panel. Payer members can't, associate members can. Our members will also have the ability to provide input into updates that we'll be making to the guiding principles and framework and the annual industry survey, and provide a quote in the annual report. And they'll also receive an advanced copy before it's released in the public domain. So there's lots of opportunity for input, and we'll certainly be notifying members of when we're making those reviews of the program guide, and we'll be inviting them to participate in that process. We'll also, and I mentioned this earlier, we'll also be having some member and associate member only events. And so without being a member or an associate member, you won't have access to those special events. So what happens if an organization has become a member and they want to become accredited? Well, there are 3 levels of accreditation, and we're going to talk about those. I mentioned earlier that both public and private payers are eligible for membership. So we know that at least two provinces, both BC and Ontario, have made improvements in their prior authorization system from a public's perspective. And we'll certainly be reaching out to them to have discussions with them about both membership and applying for accreditation. So how do you apply? Well, you apply through the accreditation panel, and payers who meet the framework requirements will receive one of the accreditations that I just showed you earlier, which are admin efficiencies, electronic prior authorization, and those payers that achieve both accreditations will then automatically receive that gold accreditation. Members, public and private, can apply for one or all accreditation, so it doesn't have to be sequential. And applications are available by contacting basically me, PAFA, and they can be submitted at any time beginning in May. So that's when the accreditation process opens. The applications will be reviewed and approved by the accreditation panel, and the successful applicants will be notified in writing. And if there is any outstanding information, it won't be an automatic denial. We'll actually go back to the successful or to the applicant and ask for some additional information. So what are the benefits? So from our perspective, we think that those that are accredited will really show their leadership position in creating efficiencies in the prior authorization process. They'll be demonstrating an improved level of service to patients and plan members and any other stakeholders that are involved in the process. Their administration expenses should definitely reduce because they're going to be spending less time back and forth with patients, adjudicating claims, and there'll be a reduction in administration cost as a result. We can talk a little bit more about that at the next webinar, because I have some specific thoughts on details of how administration expenses can be reduced. Accredited members will also be differentiating themselves from other organizations, from their competitors, and they will receive that industry recognition. So it won't just be PAFA that's recognizing them, but they'll be able to, or they will receive recognition from other stakeholders, particularly their competitors, and gain a competitive advantage for not only retaining existing business, but securing new business. They will be a preferred payer for advisors and plan sponsors. And so we truly believe that this will be the case with the efficiencies that will be created through the accreditation process. There'll be an overall win for those that are accredited. That's not all, though. There'll be, of course, recognition on our prior auth website. We'll also be making new accredited payer announcements in featured blogs and articles. Our last webinar, you may have noticed, because we sent out an announcement about it, but we had Benefits and Pensions Monitor on the line, and they did a great write-up of our last webinar. So I think you'll see that we're definitely getting some attention from the benefits media. They will also be invited to participate in PAFA webinars and industry events to discuss their accreditation journey, and they will be featured in our annual PAFA report. They, again, will have the use of the PAFA accreditation logo for whichever accreditation level they've received. So there's lots of opportunities to, for once an organization is accredited, to not only gain that competitive edge, but also be recognized and continue to be involved in PAFA. So in terms of working together, we really believe that there are benefits for everyone. We think we've created a PA process that is more patient-centric, efficient, and effective. So that basically the framework and the accreditation criteria will really create that process. There will be reductions in administration hassles and expenses for all stakeholders, and there'll be an improved turnaround time on prior auth claims. There'll also be the ability to deliver better care to patients and plan members, as well as recognition through accreditation for payers that support collaboration to improve prior auth, and also an industry-wide recognition program for those who become accredited. So I think by working together, all stakeholders, not just payers, that we really can realize some of these efficiencies. And particularly when it comes to something like electronic prior authorization, if we can really grapple with some of those GLP-1 claims and the administrative burden that that's creating for, particularly for payers, I think that if we can get those on EPA, then we have a lot better chance to realize some of those reductions in admin expenses. Used a little bit less time than I thought I would today. There was a lot of information. I hope I didn't go through that too quickly, but I wanted to keep it lively enough to keep your interest before we get to the really juicy part of the accreditation details in our final webinar. Today, as I said, we've looked at the guiding principles and the fundamental values that we used in our working group and then our larger review group. We really took those into consideration in putting the program guide together and doing their checks and balances. We think we've created a really good governance structure in terms of the board of directors, the executive director position, framework and accreditation advisory board, and the accreditation panel. So there definitely is accountability at several levels. And there also is a recognition where there is sensitive data that we need to be mindful of conflicts of interest. And of course, that's one of the key requirements of governance. I'm actually the chair of my local hospital, the chair of the board. And so I'm quite familiar with the role of the board of directors and various committees and subcommittees from a governance perspective, conflict of interest perspective as well. So I think I've really relied on that background and experience to really make sure that we have a good governance structure in place, something that people can be confident about and that is reliable and credible. And from a membership and accreditation perspective, we've done a sweep over what payer membership looks like and how to apply, and what that associate membership looks like for non-payers and how to apply, and what the benefits of membership are, certainly in terms of recognition. And I had a conversation just this week with an advisory group, and it was very interesting because it really brought home to me some of the additional benefits there are of membership. When you, as say, if you're an advisor, or even a plan sponsor, are struggling, whether it's organized labor or just with an employee yourself or with a payer, when you've got that credibility of being a member or an associate member, it also brings our resources too. So I'm certainly available with my expertise in prior authorization and the people that I know, so that even if I don't know, I can find somebody to provide some assistance to you. I think I would put that out there, that if you need to touch base, if you want some advice or an opinion about a particular situation that you find yourself in or you're experiencing, when you're a member or associate member, you can come to us. You can create that dialogue with us and ask how we can help, what resources we have available in our membership and in our network to help you solve some of the challenges that you're facing with prior authorization. And lastly, we talked about accreditation. And we talked a little bit about the applications, and they are in the process of being created, as I said, and the advisory board will approve those. And our accreditation panel will also have the opportunity to give the final say on those too. And we talked about the approval and recognition that comes with accreditation and the benefits. And there are some reporting requirements. I wasn't actually going to include that. I think it was taken out of this slide earlier in the presentation, but there are some reporting requirements. We're going to, I'm actually moved that into the next webinar. So we're going to talk a little bit about what the reporting requirements are through accreditation. And just since we have a few minutes, why we added a reporting requirement was there really isn't any public information about prior authorization benchmarks. So we don't know how, with a percentage of claims that are denied. We don't know the percentage of claims that are approved. We don't know what plan members who go through a prior authorization process think about it. We don't have any of that information. And so there are several key metrics that are included in accreditation to maintain that accreditation for annual reporting. And obviously, we're not going to single any particular carrier out, or maybe not obviously, but we definitely have no intention of singling any carrier out or any payer out. But on an aggregate basis, from an industry perspective, we think that it's really important to get some publicly available metrics in order to not only evaluate an existing payer, but also to really when you're in the situation where you are with a payer and there are some challenges with PA claims, to really have some reference material. And so I'll go into a little bit more detail on that in the next webinar. And I think we've only got sort of 2 columns in the next webinar, and we've dealt with 4 columns in this webinar, even though the guiding principles was pretty quick. I think my intention was just dealing with the framework and reporting and industry survey was really to be able to dive quite deeply into the administration framework, because there's quite a bit of detail in the administration framework. The electronic prior authorization, not quite so much detail, but there are also future opportunities that we need to discuss as well. There are different levels or iterations of electronic prior authorization. And so this guide is really designed to adapt to those future opportunities as the technology develops and is available, so that an accreditation can be expanded based on the future opportunities that are out there in the industry that become available. And of course, as I mentioned, the reporting and industry survey, we'll be going into a bit more of a deep dive on that. And we'll be talking about not just the accredited payer annual reporting that I mentioned, but we'll be talking more about the annual industry survey and what that will look like as well. Some of the things that we're considering adding to that industry survey. And of course, we'd welcome your input as well once we share with you what we have really explored so far. So I see that the chat box is empty. We've just dazzled you with all the information that we've been able to provide. We are now at 10 to 1. I think we were scheduled to go to 1:30. We better be, because that's what I've got in my mind. Yep, 1:30. So we have lots of time for discussion. We may end up finishing up early, which is fine too. We'll give you a few minutes back in your day. But we want to get into the panel discussion now. And so I'd like to ask John Anacleto and Andrew Wynn to both join me, and they should be able to control their audio and their visual as well. Here we go. There's John and Andrew. So while they're joining us, I just, for those of you that don't know John and Andrew, I'd just like to introduce them. Just from the get-go, John has been just a great help in not only being one of the reviewers of the original guide and the draft and the redraft, but he's also on the Framework and Accreditation Advisory Board, and he's also on the Board of Directors. So thanks very much, John, for the team effort. John is also a seasoned market access professional and now consultant with nearly 2 decades of experience in health and drug insurance. He has led teams in developing innovative analytic tools for clients, a market enabling informed decision-making in the competitive market. John's experience spans forecasting market access update, strategic private payer product listing, negotiations, and coordinating private payer submissions across therapeutic areas. He also holds a master's of business economics, which I know comes in handy in his data analytic work. So welcome, John. Thanks for being with us.
Pleasure to be here. Thanks for the introduction, Denise.
And also Andrew Wynn is with us. He's also a member of our advisory board, and he is an accomplished biopharmaceutical market access expert, semi-retired. Can I say that, or is that not fair?
Oh, that's fair.
Semi-retired. I hear about his nice vacations, and with an extensive track record of enabling rapid access to innovative therapies for patients and driving policy solutions and stakeholder partners. Andrew was, before he went into semi-retirement, a private payer strategy lead for AbbVie Corporation, where he worked for many years to deliver accelerated access to specialty meds for patients with private healthcare plans. And he also has experience in leadership roles in federal and provincial government affairs. So he knows kind of both sides of the coin. So I'd like to get into our discussion. We had prepared a few questions, but I would welcome those of you that are on the line to participate through the chat box. If you'd like to ask John, Andrew, or myself any questions, or if you'd like to ask any specific questions about the framework and accreditation program, or anything else that we've looked at so far. While you're thinking of all those great questions, I'll ask a couple to John and Andrew that we talked about yesterday. So, John, you helped us out with that original guide, and I know that we've been talking about this particular project for some time. Why the interest in prior auth and this PAFA guide, and why did you agree to become involved? And I'll ask first John, and then of course Andrew.
As you mentioned, with my 2 decades of experience, I have seen the utilization and growth of use of prior authorization over the years. You talked about it, especially with all the new products. And it's not just about products. We're also seeing a huge increase in number of claims that are using prior authorization. So in the different hats that I've worn, I've seen the different touch points of prior authorization and honestly the pain points that it's caused. And, you know, I've worked with teams to try to find solutions, especially the idea of digitizing the solutions, which is what the framework is really, I think, keeping people accountable to. But I haven't seen it as the main priority. So being part of this group, and I think what the framework is bringing to the market is really helping to lift, you know, the want of a solution to a need and changing the priority for the different players. And this isn't a solution by one entity because of the touch points of prior authorization. It goes through multiple hands, and this is kind of like, why does this happen? It doesn't need to happen. And I don't think until enough attention is put onto it by everyone that the solution that we need will be accomplished. So, and I think the framework and the organization that's put together, PAFA, it will help do that.
Thanks, John. Andrew, your turn.
Thanks very much, Denise, and good afternoon, everybody. So for me, having worked for several decades on the pharmaceutical industry side, I can tell you from personal observation that a lot of patients end up waiting for extended time periods such that their disease gets worse. And, in the industry, we call it disease progression, and it's real. And patients do suffer if they are not getting timely access to a drug where prior authorization is a requirement. I take to heart John's comment around this being a priority. It's clearly not a priority. Any large organization, whether it be a pharmaceutical company or an insurer, has processes in place, and those processes sometimes are antiquated and systems don't talk well together. And it takes a lot of effort and a lot of focus to make changes to those processes to make things efficient and to serve plan members better. So nothing's going to happen unless something is started. And I think that's where the framework and accreditation advisory board, or sorry, the program in general is the catalyst to make this happen, to start the conversation, to help people understand that the need is real, and that change can occur. But change is only going to occur if there's momentum behind it. And again, that's where the PAFA comes in my mind. It seems like a daunting task, but I can also say from personal experience that working with governments, whether at the federal level or at the provincial level, is not an easy task either. And it takes a long time to make change happen. Change happens collaboratively. Yes, it takes a lot of time, but it does happen. And the need is such that the folks involved with this initiative and the wider group of stakeholders who are interested, we come together, we make it happen, and accept the fact that it will take some time, but change can occur and it will occur in this particular with this particular initiative, I believe. So that's kind of my perspective, and thanks for asking, Denise.
Well, thanks. I think you've made some really good points, both of you. And I just pick up on a couple of things that Andrew said. And I really want to stress, and I know I mentioned it a little bit in the presentation, that this very much is the program is built on collaboration. So right from the get-go in the original working group to the 28 stakeholders that reviewed the guide and provided their feedback from across, the prior auth environment, to, the final kind of 8 and the working group where we really fine-tuned, the actual guide, and the endless nights I spent editing everything to make sure it was, consistent, and the people that we pulled in to help with that. It's been a very collaborative process, and I think that you can see from what we've talked about today, and again, why we really wanted to stress the governance side of the PAFA was so that you could appreciate, stakeholders could appreciate the collaborative nature of PAFA, that we have carved out 2 positions on the advisory board for payers, and they will remain vacant until they are filled by payers. And we do have some interest already, I might add, so it's not falling on deaf ears. And it's going to take a long while. Like I've been in the industry a long time, almost 40 years. So I definitely will be looking to retire, but I don't see PAFA retiring with me. I am committed to the PAFA for as long as it takes to get this up and running. And hopefully we'll be in a position to have a new executive director take over the reins, and I'll be more in the background. But I really look at this as one of 2 legacy projects in my career. And I'm very much committed to taking the time with this initiative that is required to make it successful. So, I think your points are very well taken, gentlemen. And thanks again for your commitment. I really appreciate it. And I think it's really great that many of our advisory board members are on the line today, and both Andrew and John come from somewhat diverse, different backgrounds. Andrew's been more on the pharma side, and John has been more on the patient support, the data analytics side of things. So I think you can see that we've got that diversity on our team. I've got a couple of comments, questions here. From Abby O'Neill at Mosey and Mosey. The process can be so problematic that we see a trend in CA bargaining to ask for it to be straight up removed. So they're saying that they're getting requests for prior authorization to actually be removed. And as advisors, they're striving to convey the need for prior auth in the drug management toolbox. But with so many stories and poor impacts on health outcomes, it's tough to make the case. Oh, collective agreement. Sorry. Collective agreement bargaining. Yeah, so she's saying that they're striving to make that need clear, and but there's poor impacts on health outcomes. So are you saying, Abby, that it's that poor impacts on health outcomes because of delays? Is that what you're saying? I'm not quite sure what you mean. Maybe I'm just being thick.
Maybe I can just sort of add to that in another example. When the federal employee program, the PHSCP,
You know what
transferred
you mean.
insurance carriers from Sun Life to Canada Life. I mean, it made the news on the
Yeah.
delays that they were all taking on in terms of getting approval for drugs. And so you can see how, where something may not have been experienced before, is now becoming more commonplace. And people and patients just don't understand why. And it's like, why is it so complicated? Why is this process causing delays when it shouldn't, right? So it's I think that probably adds to what Abigail is saying, is that the fact that more and more patients are experiencing the pain behind it as opposed to the solution.
Yeah, absolutely. And I think we all appreciate that with so many specialty drugs in the marketplace, that having some kind of a prior authorization system is not only just part of the landscape, but arguably very desirable in order to ensure both as a cost containment, but to make sure the right patient is getting the right drug at the right stage of their disease. But when you're getting delays in access just because of an administration process, and patients or plan members' health is suffering, which is what Abby clarified, then it's definitely telling that the system is broken, that it's not working. I mean, when we had 1 or 2 prior auth drugs, that was one thing. And I was around back in the day when that was the case. But when we're looking at on the private side, in the area of 250 drugs or more that are now requiring prior authorization, and then the GLP-1s, which have just are less high cost and more high volume. And for obvious reasons, they've got some prior authorization on them. When we've got this situation, it's not just that you're delaying access to a patient and they're waiting longer. Their health can suffer. And what that means to a plan sponsor, of course, is that they're likely less productive, that individual, and potentially off work completely. And it may compromise their long-term health outcomes as well. So it's not only about just reducing that time. There are implications for that if we don't address the time that it takes to get for patients to get access to the care they need.
Denise,
Andrew,
I'd
do you want to
like
comment?
to
Yeah,
jump in with another, sorry.
that's good. No, go ahead.
You want me to go ahead?
Yeah, I do.
Okay, thank you. So the comment I was going to make is this again sort of speaks to the need to have some data, and that's where the framework can help. Because if you are requiring insurers to report the number of prior authorizations that have been submitted, the number that have been refused, and details around that. Then you can begin to inform maybe a conversation where you're making carve-outs. Maybe certain drugs that came to market 10 or 15 years ago that are well known and well understood, maybe they can come off prior auth or have some sort of expedited route to a prior auth, maybe by a selected list of physicians with a particular expertise in their therapeutic area. But I think, again, individual insurers would have access to some of this data, but certainly plan sponsors would not have that kind of detailed information in a sample size that would be big enough to help inform some decision making. So again, I think that it's a very interesting area to explore. I think it requires some data, and hopefully that data can be provided by way of the program.
Yeah. No, absolutely. And that's certainly our hope. And again, it's not to single out any one individual payer. It's more to get an industry perspective on how prior authorization is performing in a way that we haven't been able to evaluate before. Abby has mentioned that, the unions are successfully arguing that with the challenges in administration and the lengthy time it takes to review and approve at least a fair number of those prior auth claims, that it's not even worth having. And they've been successful in arguing this in arbitration. So if that's the case, then I think that's a wake-up call, that information to payers, that if they've got an administrative process that is working so badly that that prior authorization is no longer an effective tool for the purpose that it was originally intended, then they really have to change that process and improve it so it's not so cumbersome for plan members and other stakeholders too, but mostly plan members, that this is being taken out of some plans and then therefore leaving the plan at some degree of risk, I would argue.
I think what's nice, the fact that we have health practitioner and physicians on the board who can account for that perspective, which we haven't mentioned yet. The fact that, a healthcare practitioner is filling out a form, even if it's automated, they still have to review that form. It means it's taking it away from them actually practicing health on for a patient. And the more and more they have to do that, how is that creating any efficiency? It's completely understood, on why they're asking the questions. But the whole process, like you mentioned earlier, the administration aspect behind it, is just not efficient. And which is why public governments have gone down the road of finding a technology solution, right? But it's been focused only on the public side for their service, where this has to be a solution for the entire industry. So, it's important to look at that healthcare practitioner perspective as well, and the impact it has on our health industry, not just the patients.
I know, I think you're bang on. I've had several discussions with Dr. Khan, and he's actively practicing, has a very busy practice, and he sends a significant amount of his week addressing insurance company requests for information and prior authorization for his patients. And when we're at such a shortage of medical specialists in our country, physician specialists, we really should be focusing on making their jobs easier. And in line with that, there is actually, CLIA has been looking at this, the Canadian life and health insurance industry. And in Quebec, they are mandating that insurers use one disability form. And as a result of that, the other provinces in Canada are going to be moving to one disability form. That doesn't mean they're not going to ask for further information, but there's going to be a common claim form. Now, in prior authorization, that's always been one of the stumbling blocks to improving the prior authorization process from those who've attempted it in the past. is the challenges of trying to find a common claim form. That's almost as bad of a discussion, or as difficult a discussion as talking about criteria, which we're not even going to go there because that's just not what this is, because we know that's a no-go zone, just to be very clear. But there certainly are opportunities, not just in standardizing some of the existing administration processes, which is what the administration efficiencies accreditation is about, but that electronic prior authorization. And to go back to something that Andrew said about fast tracking, one of the opportunities that we'll be talking about at our next webinar is gold carding. So if anybody is familiar at all with prior authorization in the US, this is a thing. And basically what it is that those, the payer will identify those practitioners or those prescribers that have high rates of approval for when patients submit claims, and it's this is their doctor, Dr. X. That Dr. X will then, if they have high rates of approval, their claims for their patients will be fast tracked through the prior authorization process. So it is a thing. It is something that could be added into this framework in the future. It was actually in the original concept phase for the framework, and then we decided to pull it out just for simplicity's sake and sort of what realistically could payers accomplish. And so we pulled back on that gold carding, but it's definitely something that's in our toolbox that we could look at further on the line. To go further into the EPA side of things, there are several stages of EPA, and that seems to change as the technology is developing. But as simple as we talked about this last time, just having everything online so that there's no paper mail and fax involved in the process is just will be a huge time saver. And that's already been proven that it will be. But getting to the point where some claims can be automatically adjudicated or adjudicated in real time, as we do now for non-specialty drugs at the pharmacy counter, I think that's where we get even more savings, and we get, really the maximum efficiencies where, say, a GLP-1 class of medications, the majority of claims can be approved or declined automatically through the system, and then that others may need further investigation. So I think there's lots of opportunities to make those improvements, and for this program to develop over time as the marketplace develops as well. Okay, have time for a little bit more discussion. I want to go back to something we were talking about just a little bit, and then we kind of got onto another topic, and that was, John, you mentioned this, I think. In preparation for this session, we talked about why this kind of an agnostic framework and accreditation program isn't something that we've seen coming from payers. And I know, as said in the lead up, we did talk about this at some length. And I think it was a really interesting discussion. I sort of wish we were almost recording part of our talk that we had yesterday. So I wonder if you could expand on those comments a little bit, and why PAFA and why not CLEAR, or why not the big three getting together and putting this together, or why not, a PSP? Like, why an independent non-for-profit? Why PAFA?
Yeah, well, if we think of the current environment whereby a form potentially touches multiple people, like the insurer will create the form, it has to go to the physician, it has to go to the patient, has to go back, and then the pharmacy gets involved. There are so many touch points involved in this whole process, which is what makes it a bit complicated. Beyond that, if one organization brings a solution, as an example, the Ontario government bringing their solution, it only serves them for the drugs they cover, and then everybody else is still left out in the cold. So the physicians will have to follow one format for public payers in Ontario and a different format for everyone else. So this is why whatever solution comes to the market has to be agnostic in order for adoption really to take off. And it's again, it's that need where, yes, we have to collaborate with still respecting people's competitive advantage in the market, but understand that this solution benefits everyone once it takes off. And that's why it has to be agnostic, because if it becomes just one payer, it's only going to ever serve one payer and certain physicians and certain patients. And we can't have that patchwork in our healthcare system again.
Yeah. No, I certainly hear you. Andrew, did you want to make comment on that at all?
Yeah, and in the meantime, as you outlined pretty clearly in the presentation, Denise, the insurers, even without having electronic prior auth, still have a process that they rely on now, which can fall under the accreditation program and see significant benefits and improvements there. So it doesn't all have to happen at once, but it can be a transition. And hopefully that transition starts and accelerates over time.
Yeah. No, I think that's a really good point, and I'm glad that you picked up on that, and hopefully others did as well on the line. That the reality is that even though EPA is something that we want to work towards, there's a lot to be said for the fact that there's administration right now is on paper, and so we have to live with that for now. If we can make that system more efficient and expedite claims, and be clearer on the actual process, so that people that are patients or plan members and other stakeholders actually understand the process better, have easier access to claim forms, access to information from payers. If we can help with that and improving turnaround times and clarity, then I think that we've done a lot with a system that isn't going away tomorrow. Eventually, yes, it will go away, but it will not go away tomorrow, in 3 years, or in 5 years. This is going to take time for adoption. For those of you that weren't on the webinar, the first webinar, we know that Green Shield and OKRX are actively working together on the electronic solution that OKRX has developed. And we expect that there will be an announcement sometime in the second half of this year about the first iteration of their solution for electronic prior authorization, and bringing that to all stakeholders involved. But that's just one insurer. Other insurers, and I can't, Abby, you would know better than I do, but I think I did count it, but there's at least 15 anyway, group insurers in the marketplace right now. And for various reasons, they all have challenges in moving to an EPA process, whether it's not directly within their control because their PA claims are managed by a pharmacy benefits manager, or whether they're so large that making any significant change to their prior authorization process, particularly one that requires a technology solution, is such a big job with all the other jobs they have on their list, that it will take time to implement. They all have their challenges. So it will take time to move to EPA. Eventually, I think we'll get there. But until then, at least payers have options, and we're able to help move the industry forward to creating at least a better interim solution until we can get to EPA. And when we do get to EPA, make sure that there are some identifiable requirements that will help plan sponsors and advisors differentiate an accredited versus a non-accredited payer. So, yeah, and I know that you might think, well, this is something CLIA should do, but they've been trying. And one of the challenges with CLIA is that everybody has to agree. And if not all of their members agree, and they have dissenting opinions, then it doesn't happen. So this is really not something that is a job for CLIA. I know they'd like to see it, but it isn't a job for the Canadian Life and Health Insurance Association, or the job of any 1, 2, or 3 carriers. So we're really pleased that, we're able to help fill this spot. And given the early discussions that I've had, I think there's a lot of interest in this, and I think we'll be looking forward to a successful year in our first year of operation. So what I'd like to do now, I know we're at about 20 after, so we do have a little bit of time left. So I would invite anybody else that has a question or a comment, or maybe John and Andrew, I can ask you as we get near to signing off. What is your kind of vision for the advisory board? I mean, you've agreed to join that advisory board and work with, a mix of stakeholders. What kind of can you see the role of the advisory board taking in terms of making a difference in the environment?
I'll start. Pick up on Andrew's data analytics aspect. I think the first thing that I would like to see is essentially a baseline report card. Where are we today with this initiative from an environmental perspective? And then over time, I want to see that change. I want to see progression. And I understand that, change occurs, and in our industry, sometimes change occurs at a dinosaur's pace. It's a different analogy, but it's the one I like. And I think, our organization is one that we can help monitor it and keep people informed of it. And even ask the question as to why, if it's not moving, and what that impact is. And we're here to remind people of that. So
that's great. Thanks very much. Yeah, I think that's definitely an important aspect. And we, it was very intentionally added to the framework that we would have an industry survey, but that also we'd ask for key metrics to be provided to us from those members that are accredited. And also that a requirement that they actually have at least a plan member survey as part of their accreditation process and maintaining their accreditation, so that we have direct feedback on how the process works for the people that are impacted by it the most. Andrew, you've had time to think.
Yeah, I have. I think for me, that the payers, the other stakeholders within this ecosystem really appreciate that this is a problem and it is hurting people. And we need to address that. And that this is the right way to address that, insofar as there's been a lot of research done to come up with the framework that will be presented in more detail at the next webinar. That there's been a lot of work done to scan the environment and see what needs to be done, what the best practices are, how this can evolve over time. But in terms of a key measurement of success, it's about the membership. We've got to get some members on board. And I would say, we haven't discussed this within the group, but my own personal opinion is associate members are almost, or maybe as important as full members, in terms of getting behind this and helping build momentum so that we can deliver some outcomes that are actually going to help people.
I couldn't agree more. That's when when we were looking at putting this together and we're discussing, okay, what are the benefits of membership and associate members, and how can we actually help payers move forward with better prior authorization practices and become members. And we really saw that the associate members were going to be the drivers behind payers making changes, that we're looking to advisors, patient groups, physician groups, pharmacy, to really but particularly advisors and plan sponsors, to put some pressure on payers to say, look, you need to do better, and we need to see, are you a member? Are you accredited with PAFA? And that is going to be one of our differentiators when we, or one of our metrics when we evaluate you for renewal or a changing carrier. This is us doing our job for our clients, our plan sponsors, to see how well you perform and how committed you are to doing the best job in prior authorization that you can possibly do. And so I know we've got mostly advisors on the line, and so I would just encourage you, associate member, lots of benefits, or non-associate member. It's not a cheap membership, and I recognize that. Please start talking to your payers. Ask them, are you a member? Do you plan on applying for accreditation? Do you know about PAFA? Having those conversations with your reps, I guarantee they will be going to their manager, who will be going to their manager, who's in charge of prior auth, saying, what the hell is this? What is this group? And are we a member? So we really are looking at associate members, particularly plan advisors, to make a big difference in the success for PAFA. And yeah, and I think that is a really good note to end it on. So I'd like to thank John and Andrew both for being with me today and giving me some feedback on my presentation yesterday, which I really, really appreciated. And for many of our advisory board members for being here. And of course, to you, our audience, for joining us. I look forward to, just in a couple of weeks, actually. I think I originally had the date at the end of March, and I screwed it up. So we're having the next session in just 2 weeks. By that time, I hope that this recording will be on our website, and I encourage you to share the registration link for webinar number 3 with your colleagues as we get to the real nitty-gritty of what accreditation requirements actually are. So that's on February 27th. And we'll get into more discussion on the reporting and everything else. You can download the PAFA guide quite easily at our website. And you can find and just mosey around the site. It's not a huge site, but you can look at the membership and associate membership applications. You can look at some of the blogs that we've already put out that focus in on different aspects of the guide. We're going to be continuing to send those out to people. You can even see the Benefits and Pensions Monitor article on the last webinar, which was, I thought, a fantastic article. Josh did such a great job. And you can find us on LinkedIn as well. Please follow us on LinkedIn rather than just me personally. Please follow PAFA and Simplify Prior Auth as well. And we will be accepting accreditation applications in, fingers crossed, sometime in Q2 2025. And we'll be open hopefully by around May to accreditation. So thanks very much for joining us. Spread the word and help us make this a success. And once again, thanks to John and Andrew for being with us. Look forward to seeing you in a couple of weeks.
Thank you. Take care.
Buddy.